Hey, if you've just been diagnosed with MCAS or you're in the first month and feel like you're kind of drowning in conflicting advice, then this video is for you. Hi, I'm Dr. Joyce Knieff. I'm a naturopathic doctor and I see MCAS patients in my clinic every week. The most consistent thing that I hear from newly diagnosed patients is some version of, I do not know where to start. So I'm going to give you exactly that. Here is a roughly 4-week framework for what to do, in what order, in the first month after diagnosis. This is not the same video as my last one. The last video covered what MCAS actually is. This one covers what to do about it in the first 4 weeks specifically, because how you spend the first month sort of sets the trajectory for everything that follows. Right, so the first 4 weeks of MCAS treatment are not about the optimization. They're about regulation. Most newly diagnosed patients try to optimize a little too early, and that's when the sort of spiral can start. And this is what I see in clinic. A patient gets a diagnosis, or they suspect that they have this diagnosis, and they go online, and then within a week, they're on like 8 different supplements, a 5-food diet, and then a liver detox protocol at the same time. And then 3 weeks later, they come see me and they feel worse than they did when they were diagnosed. This is not because the protocols are wrong in isolation. This is because the entire order is kind of wrong. The first 4 weeks are not the time to detox. They're not the time to mess with your hormones. They're not the time to add 12 additional supplements just because you read about them or social media influencers talked about them. The first 4 weeks are a time to stabilize the system, identify your specific patterns, and then build the platform that everything else stands on. So I'm going to walk you through this week by week. Week 1 is to stabilize. Week 2 is to identify more of a pattern now that you've had some stabilization. Week 3 is to build capacity. Week 4 is to reassess and sequence forward. And each of these weeks have a specific job. And each week has things that you should not do yet. All of these things kind of matter together in the grand strategy of things, okay? So week 1 has one job: reduce the mediator burden enough that your nervous system can stop firing alarm signals all of the time. And here are 4 things to pay attention in week 1. First is antihistamines, specifically an H1 antihistamine like cetirizine or loratadine, plus an H2 antihistamine like famotidine. Most patients are kind of surprised to find that the H2 one does matter, but mast cells release histamine that act on both receptor types. So if you're only blocking H1, then you're kind of leaving off the other half of the active response. The standard pairing is cetirizine at 10 milligrams in the morning plus famotidine 20 to 40 milligrams twice a day. But again, talk to your doctor about dosing for your case. But that's the framework that most MCAS literate clinicians start with. There's some experimentation with different H1 blockers too. The second lever here is nervous system calming. Again, this is not optional. This is not sort of like a soft woo-woo thing. The vagus nerve and the mast cells are in constant conversation. When your nervous system is in fight or flight, mast cells degranulate more easily. So week 1 includes 10 to 20 minutes a day of something that genuinely calms you down. This can be slow breathing, a walk outside, lying flat with your eyes closed. The specific practice kind of matters less than being able to do it consistently. The third thing that you can do here is diet simplification. But here's the trap. Patients hear simplified diet and then they start removing foods. That is the opposite of what week 1 needs. Week 1 is about eating fewer trigger foods, not eliminating everything in your book. Pick 3 to 5 foods that you know that you tolerate and build meals around them. Stop reading new elimination diet protocols on the internet. The goal is not a low histamine diet. The goal is not a low FODMAP diet. The goal is a low decision diet for you right now that you know that you tolerate, okay? The fourth thing here is sleep. Mast cells stabilize during deep sleep. A lot of things happen during deep sleep. If you are sleeping less than 7 hours, week 1 is the week to kind of fix that. Set a hard bedtime, reduce screens 60 minutes before you go to bed. If you cannot sleep, use the lowest effective dose of a MCAS-friendly sleep aid. Something like 5 milligrams of melatonin, or talk to your clinician maybe about hydroxyzine or something else. There are a lot of herbs for this too if you're working with a naturopathic doctor. So what you do not do in week 1. Do not start a liver detox. Do not start chelation. Do not stack 10 supplements all at once. Do not begin a multi-month protocol from a podcast. Week 1 is for stabilization. Full stop. You got to figure out what's going on first, okay? Week 2, moving on to week 2. Week 2 has one job. Build a clear picture of your personal flare pattern so the rest of the treatment can be targeted and you have better communication with your doctor or a practitioner that you're working with instead of guessing. This is where a symptom journal sort of is a really good idea. And I want you to track 3 buckets every day over the next 14 days. The first bucket is food. It's not whether or not they are high histamine foods, just what you ate and what happened to you personally, because everyone's going to react differently to different things. What happened specifically in the 4 hours after you've eaten the thing? Be specific. Chicken and rice at 1 p.m., mild flush at 4 p.m. is really useful data. Had lunch, felt off later is less useful. Second bucket is your environment. Did you go outside on a high pollen day? Were you near a candle or a cleaning product? Was the weather changing? Were you near someone who was wearing a lot of fragrances? MCAS patients react to environmental shifts at rates that sort of surprise patients, but not so much when a experienced clinician sort of hears these patterns. The third bucket is stress and sleep. Rate your stress for the day on a scale of either 1 to 5 or 1 to 10. Note your sleep hours and then mark anything that is emotionally significant that happened through that day as well. After 14 days of this, look for clusters. Most patients find that their flares are not super random. They cluster around specific food categories, specific environmental exposures, or specific stress events. That clustering is the foundation for all of the decisions that we can make in weeks 3 and 4. Week 2 is also the right time for conservative testing if you have not done that already. A serum tryptase drawn during a flare or shortly after, as well as a baseline, can be very informative to whether or not you have a classically activating mast cell activation syndrome. Basic gut markers like a comprehensive stool analysis can clarify whether or not SIBO or dysbiosis is playing a role in this. But also here's another rule. Do not order 12 different panels in week 2. Do not order mold testing, hormone testing, and gut testing all at once. Order what you would actually act on, okay? Tests that you cannot interpret or act on are just extra noise. What you do not do in week 2 is do not change your week 1 protocol. Do not add new supplements. Do not pursue advanced testing like organic acids or heavy metals just yet because we can't touch detoxification yet anyway. Week 2 is observation, gathering data that you can actually act on and plan on rather than just reacting, okay? Week 3 has one job. Add the supplements that increase your mast cell stabilization capacity, but do in the right order, at the right dosages, with the right purposes in mind, okay? This is the week that most patients sort of make mistakes by adding too much, so I want to be a little bit more specific here. The first add very often is something that complements the antihistamine stuff, like quercetin. Quercetin is a flavonoid that stabilizes mast cell membranes, and the therapeutic dose is roughly 500 milligrams to 1,000 milligrams, roughly twice a day. So anywhere between 1 to 3 times a day. Usually taken with food. Most multivitamins contain maybe about 50 to 100 milligrams of quercetin. That's sort of a maintenance antioxidant dose. It's not a therapeutic dose. So if you are taking quercetin and you don't feel any difference, the most common reason is that the dose is a little bit too low. So check the bottle. The second is luteolin. Luteolin is a related flavonoid to quercetin. They're very often paired together. And the thing about luteolin is that it crosses the blood-brain barrier and addresses the brain fog component of mast cell activation syndrome. The standard dose of luteolin is typically 100 to 200 milligrams twice a day. A lot of MCAS-specific blends combine quercetin and luteolin, and this is fine. A third supplement here is vitamin C, specifically buffered or liposomal vitamin C. 1,000 milligrams 2 to 3 times a day is pretty typical, Vitamin C supports mast cell stabilization through different mechanisms, and it's one of the most cost-effective adds when you're starting a supplement stack specifically for mast cell activation syndrome. The goal here, again, is to move your body in a way that supports lymphatic drainage, not sort of like really aggressively exercising your body, okay? So what you do not do in week 3, several things. Don't start a binder. Don't start Cromolyn yet until you're unless your doctor has had a conversation with you about Cromolyn and has prescribed it specifically. Don't start multiple different mast cell stabilizers all at once. Like if you're starting Quercetin and Luteolin already, don't also throw Cromolyn, Ketotofin right on top of it. Don't start randomly eliminating things. Again, I've sort of beat this to death here, but don't go full on antihistamine, full on low FODMAP if we don't know what your pattern is. What we're trying to do in week 3 here is stack things up intentionally, not overly aggressively, okay? And when we move on to week 4 has one job. Step back, look at the pattern data from week 2, and decide what comes next, okay? This is the decision tree from this point on, and this is sort of what I do in clinic. If your symptoms are 50% better or more, then this framework is working. Stay the course for another 2 to 4 weeks before adding anything or removing any foods. Stability is the goal. If your symptoms are 25% to 50% better, then you're on the right track, but you have something going on. There's like a cofactor that is coming in and influencing this thing. The most common cofactor present at this point is gut dysbiosis for SIBO or some sort of other thing that's going on. So the next sequence intervention then is more of gut work in weeks 5 to 8. Week 4 is also when finding a clinician that is going to partner with you on this makes a lot of sense. If you haven't already, going to a clinician in week 1 is oftentimes not the most fruitful visit because you don't have the pattern data to make the visit productive. Going in week 4 with that 14 to 21 days of symptom journaling and a clear sense of what changed when and how you introduced things and how you reacted to them, that's a completely different conversation because now you have so much data for the clinician to work with to kind of piece together what is going on in your body. So the general sequencing arc after the first 4 weeks looks sort of like this: stabilize, then gut, then liver, then hormones, in that order. And the reason that order matters is because there's a mechanical thing going on. The bile from the liver dumps into gut, so a leaky gut can send those metabolites back into circulation. The hormones are processed through the liver, so a congested liver makes hormonal interventions more reactive. So skipping ahead doesn't necessarily save time, it costs time because a lot of people can trigger reactions instead. So we need to build from bottom up. After you're stabilized, after you got the pattern, then we can work on the gut, work on the liver, work on the hormones, and sort of build up through there. If you want a written version of this 4-week framework with sort of these dosing ranges and the sequencing decision tree, I kind of put together a free guide. It's called MCAS What You Need to Know First. It's a PDF. It's a little bit long, so give it a skim. It's longer than this video. It's a little bit more detailed in there. It also will mention a structured 12-week program for mast cell activation syndrome patients that sort of takes this framework a little bit deeper. I'm doing live sessions and hopefully going to find a community of patients to walk through it together. And if that's something that you would want to know about when it comes, then the roadmap download will give you some emails. We also have a sort of wait list for it. We're collecting responses as to what you want to see in a live session and what discussion points would be the most helpful for you and what times work best for you to sort of meet on these live sessions. If this video helped you make sense of where you are in the first month, then leave me a comment with what week you are on. I read them, and if you know someone who has just been diagnosed and is feeling lost, send them this video. And I know that the first month is hardest, and having sort of a sequence and a framework of what to do can be really helpful. Take care of yourself, and I'll see you in the next one, okay?